Hey, I want to get in here and really give some guidance and inspiration to your patient experience teams, whether you're setting up one or you've got an existing one. Many healthcare organizations do. So, I want to really talk about the two main focuses. And what made me really think about this was that recently I was on a call with one of our clients, and that client was really excited about a result, and that result was a decrease in patient complaints. In fact, a little backstory on this organization is that they actually got a grant to work with us because their patient satisfaction was one of the bottom two in their entire state. And so that qualified them to seek out some grant money and receive a grant to work on that. So, as part of that, in our work with them, they set up a structure of teams, one of which was a patient experience team. And so, as we were talking about how their organization was progressing in these efforts, the initiative champion reported how they've had a huge decrease in their formal written patient complaints. And in fact, the number was as high as about one a day or about 90 plus a quarter as their baseline. And so obviously they were working to improve their patient satisfaction survey results, decrease the amount of complaints that were received, those kind of things as part of their, what are they trying to achieve? And so the great result that she recently reported was for the first quarter of this year, patient complaints for the first quarter was 11 compared to last year where it was more than 90 in a quarter. So that's like an 85 to 90% reduction in patient formal written complaints, which is great. And so I said to her, you know, what do you think is leading to this great improvement, like this vast, unbelievable improvement? What do you think is making a difference? And right away, she pointed to one of the positive communication standards, which is frontline service recovery. And so, yeah, that makes a lot of sense, right? That's like a really good connection between, reduced complaints, improved patient experience is for employees to really be empowered to recognize dissatisfaction in the moment, act on it right away to resolve it in the moment so that there are less things that are escalated to formal written complaints. So yeah, that certainly is one of those things. But what it really, though, also pointed to me to is, going deeper than that, going deeper than one positive communication standard. What had their patient experience team been doing over the course of their action plan beyond service recovery and training and that related to service recovery? And really, it was two main big rocks that their team was focused on, and it was really probably the combination of the work towards those two main focuses that were really, synergizing and coming together to create this amazing result. And this result for them is really, amazing. We get so excited when we see this, but we also know that our other clients with their patient experience teams have been able to go from average patient satisfaction to top ranking 5-star patient satisfaction and be able to sustain that year after year. So, what this team was doing in this organization that was drastically reducing complaints is also what we know our patient experience teams are doing in other organizations that are, really helping them reach that top ranking, award-winning 5-star patient satisfaction. So I thought I'd come in here today and just share what those two big focuses are so that if you are starting a patient experience team in your organization, or if you have a patient experience team in your organization, or wanting, to really, know what their focus should be, what is it that's working for our clients? And really, that's these two main focus, one of which is high standards. And so I mentioned, service recovery is, a standard that this organization had adopted, but it's one of 12. So we call them the positive communication standards. And some organizations, they might call that their customer service program. And we get that question a lot is, what should be part of our customer service, program? What should we be training our employees on to improve customer service or the patient experience? And for us, for more than a decade, with dozens of organizations and coaching and planning for dozens of patient experience teams, them being corely focused on and responsible for a set of high standards for how we mainly communicate and interact as team members with each other, with our patients, with our family members, things like hallway hospitality, service recovery, managing up. These are examples of 12 positive communication standards that really are core to a patient experience improvement initiative. And beyond that, they really help with the employee experience too. So, so that you kind of get a double win with them. But yeah, those standards is one of those core focuses, and the team needs to own it long term. So we recently did a webinar on the 5 steps for improving teamwork and patient care and safety. And we really do believe that the patient experience is about safe and satisfying care. And truly, these 12 standards are core to those 5 steps to being a great organization in this way. And so the standards is one of those core focuses, and they're really foundational. They're common across the entire organization. They're common sense, not commonly and consistently practiced by all. And so a team needs to own that long term. And in the work that we do with our clients, it's the patient experience team that owns those 12 positive communication standards, bringing and keeping them alive using those 5 steps that we talked about recently in a public webinar. And then the other focus is really on those unique opportunities that are coming out of your data and your surveys. So if we couple these common communication standards that are, could be common and consistent across the entire organization, this is how we do it around here, and you couple that with what are our unique opportunities that are coming out of our data, such as whether it's quiet or parking or whatever. And sometimes that's parking isn't a good example exactly for a patient experience team always. But so the idea is if we couple foundational things with unique things that are coming out of our specific data, then we've kind of got this 1-2 punch where we're working on improving the patient experience with some very foundational things through our standards that we bring and keep alive. And then we're working on, our unique opportunities for improvements and what is it our patients are saying, really honoring the voice of our patients about those unique opportunities such as quiet or wayfinding and things of that nature. So being survey specific or data specific and then standard specific in our 2 focuses of our patient experience team are really the 1-2 punch that leads organizations like that one I mentioned at the start of here that can dramatically improve things like patient complaints in, in a pretty short period of time. And we can make this easier for organizations. We really can, in particular, those organizations where we may not have what we call a partnership, which is a long-term relationship to set up, a whole structure of teams that are working on improving both the employee and patient experience. But if your patient experience team is looking for that standards piece, you don't have to reinvent the wheel. We've been using this core set of positive communication standards. It's expanded to 12 core positive communication standards. And we created recently in this year a Just Start solution set, which includes done-for-you videos, flyers, handouts, graphics, that help organizations be able to understand what these 12 standards are, be able to introduce them and bring them and keep them alive in their organization through the work of a patient experience team, which we encourage to be employee driven. And not only do we, give you all the information about these 12 standards, but we also give you the 5-step plan about setting up the team and what the team actually needs to do to be able to bring and keep these standards alive in your organization. So I wanted to let you know that, these two core things are so key to your patient experience team efforts. And on the one hand, when it comes to the standards, you truly don't need to reinvent the wheel. And we're here to help if you're interested in learning more about those 12 standards or wanting to learn more about our Just Start solutions for those 12 standards. You can go to our website, capstoneleadership.net. And you can see there that there's a contact us page where you can actually schedule and book a call to learn more about our positive communication standards and our Just Start solutions for bringing these standards into your organization to help with your patient experience improvement efforts. And if you book one of those calls and we have that call, we also have a free gift for you, which is actually a solution set for our hallway hospitality. So, a short animated video, a flyer, some graphics so that you could start with one of those positive communication standards right away while you consider whether or not adopting all 12 would be a great decision for your organization. So there we go. Two big rocks for your patient experience team: standards and data driven improvement action plans. So there we go.